The coronavirus pandemic has had a huge negative impact on the world as a whole. Lives have been lost, jobs, people have been displaced from their homes, you name it. In regards to this, the Cabinet Secretary for Public Service and Gender, Professor Margaret Kobia, has today handed over COVID-19 donations to women caucus leaders at the National Youth Service headquarters in Ruaraka. These items will be distributed to the most vulnerable families across the country. As a result of the coronavirus pandemic, various organizations such as the Women Enterprise Fund, UWEZO, UNFPA, among many others, came together and donated food and non-food items for people in vulnerable communities.
We know that 70% of women in Kenya are in the low wage bracket. 70% of health workers in Kenya are also women. 35% of cases that were reported on sexual violence in the first 2 weeks of COVID-19 were on sexual violence. And then domestic violence went up almost 700 times, according to the data that was collected through the national hotline. This national hotline 1195, it showed an increase of 775% since COVID-19 started. So in actual numbers, we have at the third week of June, 834 cases that have gone through reported gender-based violence cases, compared to 86 only in February before the COVID-19 started. There's also been an increase in FGM cases in counties such as West Pokot, recording as high as 141 cases, according to sources. Globally, we know that 90,000 health workers have been infected with COVID-19, and in Kenya, this number stood at 72 by the beginning of COVID-19.
The Cabinet Secretary for Public Service and Gender, Professor Margaret Kobia, has today handed over the COVID-19 donations to women caucus leaders at the National Youth Service headquarters in Ruaraka.
Many times we might have different interests, politically and diversity in many ways. But when it comes to serving women and men of the grassroots, I think women, members of parliament represented here and other leaders, we have a bigger purpose. And that's why we keep talking about a common women agenda, because the common women agenda is getting better quality of life for the citizens of Kenya. COVID-19 crisis is like a crisis like no any other. And as even we shared this platform this morning, we can for sure say it has affected men and women differently. Therefore, in this impact, then we are trying to see what intervention would the government be able to give. And the government cannot work alone. That's why partnership from UN Women, from UNFPA, from other non-government organizations, including CRU, is very critical that all our hands on deck, so that this crisis, which is like any other, we are able to find some solutions, and for sure you can be able to say these solutions or the intervention we have injected, they have made a difference.
According to a report by the Healthcare Assistance Kenya, there has been a 75% increase in gender-based violence cases in Kenya since the COVID-19 outbreak. Teenage pregnancies have also been on the rise. In Kenya today, 70% of women are in the low-wage bracket and thus cannot afford basic necessities nor the COVID-19 essentials. These donations are expected to assist people in such situations.
In this containment, I think it has also called for the needs to have the sanitizers, the soap, the girls' kit, the boys' kit, the family kit, food, because of this containment. And for the fact that we know The COVID crisis has also generated a lot of job losses. I think that's why we need to come together as the women members of parliament have asked us to do, so that we can be able to share or ease out or help in coping with those containment. In terms of National Youth Service, who have given 7,500 masks, which are here. We have also been given by UNFPA about 600 kits that the members of parliament will be able to take with them. These kits involves boys kit, girls dignity kit, and a family kit. And they have also been able to say, during this time of washing hands, we need jerry cans, we also need buckets, and they have given us about 600 of them. We have received very many sanitizers from Kenya Pipeline Corporation, and I think there's also another organization that has given us some sanitizers, which you'll be able to take to the constituencies. The Women Enterprise Fund has given us also masks and some sanitizers that we'll be able to take with you. And I'm sure crew here saying they want to partner with us to start cash transfer to the most vulnerable.
We need a gender lens, we need a gender dimension in all the activities that the government is taking. Food distribution, Madam CS, also must target women as a special group. We need a proper audit so that we can know the numbers that we are talking about during this COVID period as part of the impact, because we intend as a country to follow up, I believe, to follow up the impact of COVID going forward. But we need an audit because most of these are school-going kids.
During the event, Professor Kobia also stressed on the need for the government to prevent teenage pregnancies.
Prevention is what we are looking for, because we know also going back to school, out of those girls who become pregnant, less than 20% goes back to school. Why? Getting somebody to take care of their babies is a problem. Also, there is a stigma attached to you going back to school. And also, there is, generally, we find, in fact, most of the people or girls who get pregnant, they are coming from a poor background. So it becomes another burden for the girl to go back to school. Much as we have the policy that the baby is born, if you get somebody to take care of your child, you can go back to school, continue and do examination. Because we strongly believe that a girl, the more years a girl stays in school and attains the highest qualification, the better the chances of their quality of life. Therefore, we want them to go back to school, but we want to prevent. We have heard most of the pregnancies are actually from people who are known to them. They are happening at home. So I think what the members of parliament here and myself would be calling is to make sure that we prevent teenage pregnancies.
Reporting for Chams Media, my name is Lavenda Amunga.